Welcome to the session for application in telemedicine and nutritional care. I would like to welcome Dr. Lahari, who's done her PhD from Clemson University, USA, and is a freelance nutritionist and a wellness consultant. She is also a founder of Nutriful U in Hyderabad, and she is also part of Half Life to Health and Instagram Fitness Entrepreneurs Group. She is also part of the Foyo Fit Dubai UAE group, and she's done a number of interviews and shared her knowledge through ETV Live and ETV Abhiruchi in Telugu. And she's been a writer in the column of Doctor's Choice, also part of the Andhra Jyoti's Sunday magazine, and she's been part of the MedPlus TV for the YouTube channels of MedPlus TV and Suman TV also. Apart from this, she is also a life member of Indian Diabetic Association and a life member in the Nutrition Society of India. Coming to our moderator, Mr. Ajeesh has over about 10 years of experience into sales and marketing and has been part of MedleyMed and other companies with a good knowledge in telemedicine platform. He's been part of MedleyMed for over 1 year now. Welcome, Ajeesh. Welcome, Dr. Lahari, to the telemedicine.
Thank you so much, Mr. Andrew. Thanks for inviting me today, and welcome to MedleyMed, Dr. Lahari. We would really looking forward to hear your insights in terms of the nutritional. If you get deeply into this nutritional care, this has been majorly, if I look into my personal life also, the nutrition care post-COVID. I can believe, pre-COVID I could not care about my nutritional diet or something like that. But after COVID hits market, then we came up, a lot of people consuming vitamin supplements and all this stuff. I not even know the price medicine, which is vitamin D tablet, which is available for such supplements. I never used before anywhere. But after COVID hits, we all know these are the supplements we need to take for the nutritional things and all this stuff. But now, due to this, there is a rise of telemedicine platform. Most of, especially in COVID times, that has been accepted by the people. Most of the people are using, and how this nutrition care also been helpful in terms of a telemedicine platform. Do you see a lot of nutritional coming through the telemedicine platform?
Absolutely, especially because of COVID. Actually, first of all, thank you, MedleyMed, for giving me this platform to talk a little bit about telemedicine and how it has impacted nutritional consultation per se. So coming to your question about telemedicine and how things changed around COVID with regard to nutritional consultation, yes, absolutely. The number of online cases have increased. The consultations that I used to do online earlier used to be limited to people who were out of Hyderabad or away from the country, away from the city and such sort. Even in those cases, they would make it a point whenever they come to the city, they would make or prefer in-person consultation. Whereas COVID has made it a norm or made it quite normal to have online consultation. And I don't know about other physicians, but definitely in case of nutrition, which is in the wellness area and not clinical nutrition, people have become a lot more comfortable with taking online consultations. Earlier, it used to be like, oh, no, I must meet you in person. You have to look at me to see, whether I need a diet or not. And most of the times it used to be just related to weight itself. That's about it. More cases were about weight loss or weight management or some to do with health conditions like diabetes and heart conditions. But after COVID pandemic started and during last couple of years and almost 2.5 years and all that, a lot more people who are generally considered healthy, reasonably healthy weight and all, but, sort of unhealthy lifestyle or sedentary lifestyle, as well as I don't know what to eat kind of mindset, and also what can I eat for boosting my immunity. So these are the sort of people that started coming more. And most of these were again online consultations, and because of various platforms available, I also could completely make my consultations online only, during the last 2.5 years. So it was pretty good for me, as well as I believe for the clients also, because time is a lot more flexible, to fix an appointment. You could do an 8 o'clock in the morning or 7 o'clock in the evening, which would ideally be not possible when you have an in-person consultation. You have a lot more things to take care of and all. So this telehealth platforms have definitely helped in that matter. And they have made the follow-ups easier as well. Earlier, even for follow-up, a person had to travel, even within the city, had to travel, say, for about at least 30 minutes to come to the clinic and then spend some time talking and all that. But now, no matter where the person is, where the client is, they could just give me a call, talk over phone, or have a quick video call for 10-15 minutes, and that would save them a lot of time, as well as give me a lot of time to attend to other clients as well. So that way, yes, telemedicine definitely helped during, not only during pandemic time, but because it became a norm during pandemic time. Even now, I do a lot of my consultations online only.
Great. Good to hear that from you, Dr. Lahari. The other question is how the nutritionist helped this COVID patients in terms of this pandemic area. What kind of age groups have been majorly of the cases you've been handled? What kind of age groups of people came for this nutritional care?
During COVID, so whoever got affected, so age groups wise, it's usually the adults over 25 years, 30 years old, and then up to, I say, 75, 80 years actually. So I know it's a very large age group, but in that whole, band of age group, there were various health conditions for different kinds of groups. For working population, it's something different, say from 25 to almost 40 years, and 40 to 55, it's a different set of issues, and 55 onwards, it's a different set of issues. For, say, younger people, like 35 to or 25 to 40 years of age group, it's mostly just the impact of pandemic. Like, they got COVID, so they are either handling COVID in home isolation, or they're probably taking some medication, or they've recovered from COVID, but the symptoms still persist. Some of the symptoms like lethargy and tiredness, exhaustion, and probably some mental fog, these kind of symptoms were there.
True.
Second group is from 40 to 55, almost 60, up to senior citizens age. Those people are the ones that got impacted most, partly because of you see more sedentary lifestyle in that age group, and also, what do I say, because of overweight. Not all are obese, but overweight category being more in that age group, people were more likely to have either diabetes or pre-diabetes or hypertension, uh, which are the things that made COVID more complicated, in fact. So that age group came with, how do I handle this? I'm still not recovering from the symptoms. And the COVID also didn't test negative for a very long time. So while they had, COVID-19, as well as after they recovered from COVID-19, to regain the energy, because the energy slump in that group was pretty high. So they felt like they were never going to get back to the normal state of energy. So that was the complication with the 40 to 55, 60 years old group. The next one, in case of senior citizens, there came challenges of, when you have symptoms like loss of taste and loss of sense of smell. As such, because of age, these senses do, reduce a little bit, and they make it hard for senior citizens to get good nutrition. On top of it, when they had COVID, some of these changes became a lot more permanent than they expected. In case of youth, they recovered their sense of smell, they recovered their sense of taste, say in about 3 to 4 weeks. But in case of senior citizens, it went on for about few months, which really impacted their diet. So they didn't know what to do. They were worried about, how to eat food without feeling anything, right? You just feel like you're eating a cardboard when you can't taste anything. So you lose appetite, you lose the interest to eat. And because of COVID-19, there were some changes in mental status also, mental health. There were quite a few issues with mental health, especially because of reduced social contact between people, and also because of just so much negativity around, and what's going on with the world and everything. So the impact was a lot more in the last group in terms of nutritional compromise in nutritional status. So each of these groups needed a different kind of approach to get them to, say, pre-COVID state, or an attempt to get them to pre-COVID state. So this is what happened during the COVID period. But as it started getting tapered down, right, at the end of say 2021 and the beginning of 2022 and all, more and more people wanted to learn more about nutrition for their wellness, not just people stopped looking at nutritionists and dietitians as somebody who will help them lose weight, but they started looking at nutritionists and dietitians as people who can help them maintain a good health, who can help them not fall sick in the first place. So I started seeing more people who wanted to take care of their health. They are usually generally healthy, um, but they are a little confused about whether they are eating right or not, whether their lifestyle is good enough or not, or what other changes they need to make. And you were talking about uprise deeply, right? Like supplementation,
Right.
whether they should take any supplements or not. All these things are the changes that I saw in terms of the kind of clients that would approach me post-pandemic.
Wow, good. That was pretty nice, Dr. Lahari, came from you. In that case, we see a lot of pregnant ladies been also coming in there. Most of people also got if they normally take diets when their pregnancy period, suggested by the doctors, and how the nutrition helped in terms of the pregnancy ladies in COVID situations and all.
It definitely plays a huge role. As such, nutrition plays a very important role in case of pregnant women to maintain a
Right.
healthy pregnancy, to deliver a healthy baby.
Right.
But having COVID or getting COVID during pregnancy apparently altered a lot of things. Not in all cases, but there have been cases where the growth of the baby inside the womb also got affected because mother got COVID and how complicated it got and all. So nutritional interventions were needed in terms of supplementation, in terms of the kinds of food that was to be chosen. There were quite a few challenges. For example, during the lockdowns, obtaining fresh produce that is absolutely necessary for first trimester pregnant woman, and also getting the necessary checkups periodically. So when you can't get the checkups, what you can do at least is make sure you're eating right, and sort of measuring your weight. And this also made it very hard for pregnant women to get the necessary physical activity that is needed. It's not that pregnancy means bed rest. So pregnant women actually benefit a lot from having regular non-sedentary life. This also got impacted because of the lockdowns and because of people working from home. When you go to office, at least you take few breaks in between, you walk around and stuff like that. But uh, you know, pregnant women started working from home as well, whoever are employees, and then they also, if they are not employees, they have a spouse who is an employee who is working from home. So the pressure of catering to that person's needs also increased, along with catering to herself and her own needs. So become a little more complicated. And as a nutritionist, what they seeked from me was not just what to eat, what not to eat, but also how to eat healthy in these challenging times. Like, how do I, I know I need to get a lot of folic acid. Where do I get it from? And in case if I don't get any leafy greens for that day, where can I get it from? What are the other sources? Or we are working from 10 o'clock or 9 o'clock in the morning till 7 o'clock in the evening. I barely get any time to cook food. So how do I manage this scenario? Things like that. Those challenges need to be addressed in case of healthy pregnancies as well. And during COVID time, it has become a little more challenging than usual. So
One thing, Dr. Lahari, we see most of the nutritional care in terms of the diabetic patients. What is the major role plays in diabetes patient of nutrition?
absolutely, nutrition plays a very important role in diabetes because what is diabetes? Uncontrolled blood glucose levels. Where do you get the glucose from? The food that you eat, pretty much.
Yes.
So you control your diet, or you manage your diet in such a way that you can tweak some of your blood glucose levels. I also saw several, programs that started announcing like reverse your diabetes or forget about your diabetes for good and all those things.
Right.
Well, theoretically, yes, they are possible to an extent, provided you stick to whatever lifestyle is suggested for an entire life. But the long-term implications of such things, for example, take an example of keto diet, right? Yes, keto diet, provided it is done under medical supervision, can actually help you control diabetes, or even reduce insulin sensitive, insulin resistance, and improve insulin sensitivity and all those things. But in Indian context, how for how long can you actually stick to the keto diet and maintain the state of ketosis is a question. So although there are certain ways to do it, my personal opinion is those are not sustainable for majority of population. But consider this: India has become, or at least on the way to becoming, diabetes capital of the world. So we need a lot more robust method and a sustainable way of handling diabetes. And I feel diet plays a very important role in it. Learning how to eat and how to balance out not just what to eat, but also how to eat, when to eat, how much to eat. These are the aspects that need to be addressed as well. But when they are addressed, absolutely, you can control the diabetes. And in case of youth that are pre-diabetic right now because of the sedentary lifestyle, they can actually, from pre-diabetes, it can definitely be reversed.
Okay.
It is full-blown diabetes. Yeah, it is a very big challenge, but yes, it can be done under some special circumstances. Otherwise, maintaining and managing diabetes is as good as not having diabetes, provided you take care of your lifestyle, you take care of your diet, and you take care of your medication as well, as per the need. And in terms of diet's role, understanding what kind of carbohydrates to eat and how much to eat, when to eat those carbohydrates, whether you should measure your carbohydrates when you're taking insulin, when you're taking your other diabetes medications and all these things. Yes, it absolutely matters. And what you take your carbohydrates along with, like, whether you're taking it with good fats, whether you're taking it with good quality protein, all these things impact your blood glucose levels. It's not just diet. Being a wellness consultant, I also encourage people to live an active lifestyle. And being active is of utmost importance when somebody has diabetes. Or, active lifestyle doesn't mean you go to the gym for 60 minutes in the morning and then rest of the day you just slouch, you just sit and don't move around. No, that is not the thing. You have to have a non-sedentary lifestyle, which entails at least getting up, from your desk or wherever you are seated, moving for 90 seconds every 90 minutes. That also helps ensure, maintain good insulin sensitivity of your cells and reduce insulin resistance. And there are various ways of doing it. So absolutely, diet plays, I would say, about 40% of the role. I know it's not 80%, but the other 60%, half of it is taking care of your physical activity is absolutely important. You are diabetic and you want to get good control of your glucose, you must exercise. And exercise doesn't mean hitting the gym. Some form of physical activity, anything you enjoy is fine. And that, I say you enjoy because you need to have that sustainability factor included, definitely. The third aspect, and equally important aspect, being rest and stress reducing things. So rest is absolutely important. Rest as in sleep. I'm not talking about lying down on the bed and then watching your TV or phone or tablet until 12 o'clock in the night and not getting enough sleep. But rest as in like properly sleeping, so that is when your stress hormones actually go down. Having high levels of stress hormones also messes your metabolism as well as your glucose response and blood glucose levels and all these things. So all these things have to come together. So it's not diet alone.
Thank you so much, Dr. Lahari. I was supposed to ask you one question that you can already answered in these points. We sit, 8 hours in office, sitting at one place, talking to the clients, and continuously. We want to do any physical activities. Rest other my sales teams feel in and out of the city, but whereas we people almost 80 in our office, most of people sits at the desks. They won't do much of physical activities now. So what suggestions do you been want to give not only for these employees who've been sitting at the office, but in general people, what is the best diet to follow? You can give us some tips, and that would be helpful to our attendees as well.
Absolutely. So the first thing is, do not eat at your desk, whether you are working from home, working from office.
Okay.
No food at your desk.
Okay.
And drink a lot of water. Really, drink at least 3 liters of water, so that invariably you will have to get up from your desk. When nature calls, you attend. There is no postponing that.
Correct.
So that is one way to do it. So these are all like tricks in a way. And the third one is, as I earlier stated, 90 seconds of break every 90 minutes. 90 seconds is, easily doable. You just browse on your phone for 90 seconds without even realizing.
True.
So whatever you do, you get up, you walk and do it, so that, you're just moving around. So these are the small rules you can set. And this is also very important, especially for people who sit in front of their computer for a long time, right? Any eye doctor will tell you 20-20-20 rule. 20 seconds, 20 feet away, and every 20 minutes. But if you can't do that, at least do the 90. When you're getting up, you look around and focus on things that are away from you. So this is good for your overall health and helps you being physically active also. When I said no food at the desk, which also gives you an opportunity to get up and have some meal elsewhere, right?
Right.
So you can also take that meal time to be an extra 5 minutes and do some kind of physical activity, something as simple as a brisk walk for 5 minutes before every meal, because brisk walking after a meal is not practical. So brisk walk 5 minutes before every meal. This also helps not only controlling the blood glucose or improving insulin sensitivity, but it also helps with appetite control. Brings you into the zone of mindfulness, because you take a break from your work. When you're brisk walking, you're not thinking about work, but you're heading towards your meal. So you actually think of, what am I going to eat and why am I going to eat? So the mindfulness factor doesn't automatically come to you. So you have to facilitate that. And this is one way of doing it, taking that 5 minutes to actually contemplate about your meal and why you're eating, what you're eating, how much you choose to eat, all these things. I feel just these will actually take care of it. And probably one last thing is, put a hard stop to whatever you eat after, say, at least 9 o'clock. So I know most people say 6:30, 7 o'clock, finish your dinner. Those are impractical in a lot of cases, especially in urban settings where you're working until 9:30, 10 o'clock in the night. So try to bring it as close to 9 p.m. as possible, and do not have anything after that. No midnight snacking, no, just because I'm bored, I'm watching something, so I'll just munch on something. There are no healthy snack substitutes that you can munch on after 9 p.m. So just drop the idea and try to get to bed. So I think that's all I have.
Great. Thank you so much, Dr. Lahari, sharing your wonderful insights in terms of nutritional care. And one more last small, we always been post lunch we 5 minutes. Is that really help to the body, or it's the anti-wise we have to do that before getting into meal? We walk for 5-10 minutes, or then have the lunch. Because usually what in offices we see, we have lunch at 1 p.m. and 1:30, and we go for a 5 minutes walk. Is that good for the health, or is it bad?
So you can walk after lunch, after meal also. That's absolutely fine. But you really can't do a brisk walk, right? So there is that. Walking anytime is good. We are meant to walk. We are meant to run as humans. So walking anytime is good. So if you can spare 5 before, 5 after, it's perfect. But after you eat food, most of your blood flow or majority of your blood flow is directed towards your digestive system. So when you're walking, it is directed more towards your extremities. So the moment you are done walking and come and sit down, you might feel a little drowsy also. So you can do that, but just don't make it, very brisk walk and heavy physical activity and all that. You can just take a light stroll. It's very good. It actually could help avoid that, post-meal slump also. Most people feel a little drowsy after the meal. What kind of meal you take also impacts whether you feel drowsy or not. And not getting enough sleep in the night also makes you feel sleepy after your lunch. So there are various factors for post-lunch slump. One of those can definitely be addressed by walking before, as well as provided you have time a little bit afterwards, after lunch. But do not lie down even when you are working from home. Do not lie down after a meal. You want to take a nap also, just be in upright position in in a chair, in a recliner, in recline position, and then take a nap for about 10 to 12 minutes, but not beyond that.
Okay. Wow, that's a great information, Dr. Lahari. And definitely it will help us more to get active rather than being drowsy in office going forward. Anyways, thank you so much, Dr. Lahari, taking your valuable time for attending our webinar. This is more valuable information which we received, and I hope our attendees also been received the same. Anything you want to add, Anirudh, here?
Nothing, Ajeesh. That is it from my side. So, thank you, Dr. Lahari, for sharing a all your knowledge and having a wonderful session with us. Thank you, Ajeesh, for moderating it. Thanks a lot.
Thank you once again, Dr. Lahari.
Thanks. Bye-bye.